Hi, I'm Frank, I'm the CEO of TPP, and this video is up hopefully for the families and friends of our staff. And you might be wondering why they're still coming to work and what are they doing, and I can tell you that the work is of vital national importance, working on the COVID-19 stuff. I want to share with you some of the things that your loved ones have been doing over the past weeks. I can assure you they make a massive difference. We've set up various COVID units around the company, various shared administrations, all sorts of reports that are going out across enhanced summary care records so the patients can be accessed in hospitals. We've increased interoperability. We've released our app, Airmid, which has got remote video consultations for patients and doctors. Electronic prescribing into the community, which has happened as well. We've also prepared data dumps for UK Biobank, and they're going to be researching genomics against our data. We've also working with Oxford University and London School of Hygiene and Tropical Medicine. We've combined our resources, and we're running models now from our data centre, which will be feeding straight into the SAGE committee, which you see reporting every day. Independently, we run our own models. We're now we've got a 19-day predictor from symptom to hospital admission, and that was very helpful. We were able to predict the peak of the virus, and at this moment in time, we can now tell you that we're a week over the peak. And we're very confident of that, but it's also going to be extraordinarily useful. Now, we've got a 7-day indicator as well. We've been doing lots of research into, why the different ethnicities and why it affects different ages. And we're now those indicators have become extraordinarily important as we move to post-lockdown. So we need to be able to spot the outbreaks again. So your loved ones are doing work that's of vital importance, and we're trying to stay as safe as possible, so thank you very much.
Hi everyone, just to let you know that we're coming into work in the office up here every day at the moment when we're staying in Leeds. We're all keeping safe. We're doing lots of work on COVID stuff, which has actually been really interesting, but we just wanted to let you know that we're all hunky-dory while we're doing it up here.
So during the coronavirus crisis, we've been coming to work constantly to support the NHS through the building of templates, through reports, and a lot of different other products that we've been trying to get out with regards to things like the app that we've been producing to get it available for our frontline NHS staff. I'd like to say thank you to my wife, who's been letting me come to work. We've all been hearing about how important it is to stay at home, but for a lot of us, we do need to get out and come to work. She's been very worried about me coming to work and mixing with everybody else, but the workplace has been nice and secure with social distancing, so it's been quite safe, but to set her mind at ease, I'd like to say thank you.
Hi, I'm Sam. I've been coming in to monitor fever and other COVID symptoms around the country so we can spot outbreaks and check that we're doing the right things. I'd like to thank my wife for putting up with me being grumpy and tired and making me a nice lunch whenever I go home at lunchtime. I know people are worried about us being in at work and everything, but I've never seen people washing their hands so often or using quite so much hand gel. And we're nicely spread out, we're not all up in each other's space all the time, so yeah, I feel very safe and secure.
Hello, my name's Rosa. I work on the account team, and my team have been coming into work. We've been responsible for making sure that all of our customers know about all of the fantastic work that the coders and analysts have been doing to design the solutions to help the NHS through COVID. So not only do we give all that information out to our customers, we kind of are listening to them and making sure we're ringing them all day, every day to find out anything new that they might need, any changes in their area. We've been helping communicate some of the trends that we're spotting through looking at the data, and that's been really cool to be able to help with that. So yeah, it's important that we're all here. I'm glad to still be able to come into work, and we're very safe with social distancing and everything that's in place. And yeah, I'm just so glad that we can still come in and help.
Hi, I'm Amanda. I just want to say that I'm really proud to be coming to work to support the NHS during this really difficult time. I know from the positive feedback that we've received that the work we are doing will really help the delivery of healthcare, which will benefit my friends and my family, and hopefully get my little boy back to school much quicker.
Hi there, I'm Annalie, I'm a software developer here at TPP. I've been coming into work these last few days looking at some of the statistics behind the COVID outbreak and just trying to look at some patterns in that data. It's been good working here in this environment. It does feel like a safe place. There's plenty of space between our desks. We're washing our hands lots, and in a way it's just felt like a reassuring place to work. And we do feel like we've been doing something good for the community.
I am Matt Hatfield, I'm in the hardware team here at TPP. The project I've been working on recently is the Open Corona project. We're collaborating with Oxford University and other parties to look into clinical trials and drugs that we can do, and we're providing uploads of databases so they can help that. Also, I'd like to say thanks to everyone really at work. We're all keeping social distancing and keeping each other's spirits up, and thanks to my family, especially my sister who's working on the front line. She's doing a fantastic job. Keep going.
Hi, I'm Daniel. I'm a software developer at TPP. I've been working on various interoperability projects during coronavirus in order to help clinicians be able to do their job more efficiently. In order to set my family's minds at risk during this time when I've still been going into work. We've all been socially distancing at work and washing our hands frequently, so I'm not worried at all about catching coronavirus here.
So I've been working on a few things during COVID-19. Probably the biggest thing is rolling out Airmid. So that is the app that is going to give patients access to their existing System 1 records. So wherever they go in the country, they have access to their basic information that they can show to whoever's treating them, regardless of what system they use. So that's really useful. That has also now had some data entry templates built into it, which means that users of the app can help us with research, so they can record symptoms that they have, so we can understand how the prevalence of those symptoms is affecting COVID. So things like sense of smell and sense of taste being lost, we're able to now collect data to see who is having those symptoms, as well as mental health data, so anxiety that people are feeling in the current situation, which is important not to neglect. The other things I've been working on are around hospitals doing contact tracing. So if you're a hospital who has identified a positive case with COVID-19, we want you to be able to very quickly see who else has been in a location with that patient, so you can immediately start testing the right people and isolating them if needs be, and preventing any further spread in the hospital. The last thing that's been quite interesting is working with Oxford on the drug trials that they're doing. So they're one of 7 organisations that have been given funding to do research into the drugs that might help patients with COVID. So we're using the app to help them collect data directly from patients as part of that trial, which will mean that they expedite the process of understanding how those drugs are affecting the treatment of those patients, which could have really significant benefits in terms of getting something out quickly that's going to help.
Hi, I'm David. I've been working on the patient app called Airmid, and patients can use that to track symptoms of COVID-19 and also use it for remote access to their medical records and to do video consultations.
Hi, I'm Chris Andrews. I work as a deployment specialist here at TPP. I think as a whole, the whole company's response to the COVID-19 outbreak has been phenomenal, really. Us as a team specifically, I guess our involvement has been, we've been setting up a lot of COVID-19 specific new units for a lot of organisations across the country to help with the outbreak. and help them obviously access their patient data as quickly as possible. In terms of, I guess, in regard to government guidelines, we're safe, we are following, although we are deemed as key workers, so we are coming into work, obviously not staying at home, but we are obviously following guidelines, as I say, by washing hands thoroughly, social distancing. I personally have no issues or no problems with coming to work.
Hi, I'm Lee. I work on the hardware team. For the last couple of weeks we've been coming into the office while everybody else has been on lockdown. We've been working on the Open Corona project and obviously trying to keep everyone working in the office in a stressful environment. I'd like to say thank you to everyone in our team who's working extremely hard, staying late, putting extra shifts in whenever we needed. So thanks.
Hi, I'm Richard Crossley, a product specialist here at TPP. Our role as a training team has very much changed since COVID-19. Instead of being out at GP surgeries or at hospitals training people on the ground, a lot of our work has been remote. We've been developing a lot of e-learning material to support our users out there on COVID-19. Hope everyone keeps safe.
All right, okay, well, yeah, I'd like to say we're working hard at TPP, trying to support the NHS and stuff. I'm a software developer and I've been working on trying to support the government with some of their research projects, and as well as doing some work on trying to open up some stuff to make sure that everyone gets the correct care they're getting wherever they go and whoever they're seeing in the NHS. I think the work that I've been doing has helped people, so I think that makes me feel better about coming to work, and obviously there is a risk in that, but I think the trade-off is obviously for the better. To my family, obviously, everyone's been told to stay indoors and stuff, and I think that it can be difficult when someone's deemed to be essential to have that risk. But I think what I'd say is that what I'm doing is making a difference, and I think that's where I want to be. I want to be making a difference.
Hi, I'm Manash. I'm a deployment specialist here at TPP. I think what we're doing really well is doing our best to support the NHS throughout this COVID pandemic. In terms of deployment specialists specifically, we're helping to create and set up new units that can be used by trusts to tackle COVID. I think what's important to highlight is that we're all working here extremely safely. We're taking into account all the social distancing measures to ensure that work is a safe place for us all to come to.
First of all, I want to thank the NHS for all the work they're doing. We're working as hard as we can to help support frontline services by introducing new features, new functionalities to make their lives easier. So we've been working on making sure that the system can work in new ways to support the new ways in which the NHS are working. I know a lot of my friends and family are worried. They're having to spend time at home, social distancing. We're doing a lot of that as well in the office to make sure that we're safe so that we can continue to support the NHS. There's a lot of worried friends, family out there, but we're doing all we can to make sure we're safe so we can continue to support our frontline services.
Hi, I'm Emily and I'm a deployment specialist at TPP. In order to overcome the COVID outbreak, we have decided to postpone all migrations to System 1. This means that we're not going out of the office, so we're reducing the spread of the virus and we're all keeping safe. However, we have decided to continue with one particular migration, which we're doing remotely, and this is because they are the last practice within their primary care network to not be on System 1. So migrating to System 1 enables them to work together with these other practices and effectively manage the COVID pandemic.
Hi, so I'm Chris Purcell, I'm one of the product specialists at TPP. It's been quite a challenging but really interesting couple of weeks here at the company. We've all pulled together to get through this effort. We've been doing loads of really interesting work, but importantly we've been supported and we all feel safe. And it's as I say, it's been an interesting couple of weeks. Thank you.
Hello, my name's Olivia and I work in the deployments team. It's just a message to my family to let them know that although we are in the office, we are all obviously social distancing and keeping our distance from each other. And the work that we're doing here is actually really important. One of the things that I've been working on is we've been giving units free of charge COVID units. The units need these to help manage their COVID patients. We've been making sure that we set these units up really quickly and sometimes often within the same day of receiving the request.
Hi, my name is Beth. I work in the data migration team. In the last week, we've enabled over 300 organisations across all different healthcare settings with EPS. This means that rather than the patient going to the practice to collect their prescription, the prescription has been sent electronically to the pharmacy, and then the patient's able to go directly to the pharmacy to collect their medication.
Hi, I'm Vicky. I work in the commercial team here at TPP, although I've been helping our analyst team a lot more in the current climate. I hope I've made my family proud. As NHS and frontline key workers, it's a pleasure coming into work, helping them support the great effort to help our country heal.
Hiya, so I'm Gary, I'm one of the account managers at the company. So me and my team have been speaking to our NHS customers, so NHS customers in the UK, but also our customers in the Middle East and China, to help understand any things that we can help support them with during this COVID pandemic. It's genuinely been amazing coming to work and actually feeling like you're helping people and making a difference, which is why I wanted this job originally. And in work in the office itself, we're all social distancing and following the social distancing guidelines, but it's great to work together as a team to try and help our customers. I'd like to say hi to my mum. I know that she was especially really worried about the fact that I was coming into the office and to work, but I think the main thing to say is we're really making a difference, and the best way to do that is in the office with all the teams available, and that we are following the social distancing guidelines. And when I speak to her every day, you can tell over time that she's completely relaxed and she's hopefully proud of what I'm doing and what we're doing as a company. So thanks, Mum. Hi.
Hi there, I'm Paul. I'm one of the product specialists here at TPP. As you can imagine, we've been extremely busy over the last couple of weeks during the COVID pandemic. We've had a lot of extra additional work to what we normally have done, but it's been great to see the system develop so quickly. Personally, I've been working with the Airmid app, helping develop some content so that patients can complete assessments on the app so that we can start to collect some data around people's COVID symptoms. In addition to that, I've been working on a project for one of the Nightingale hospitals, the possible chance of them using System 1 to help sort of within their ICU. I think on a personal point, I just want to say thank you very much to my family. Coming to work every day, they've had some concerns as to how safe that is, but they're really reassured when I tell them about, you know, everyone in the office social distancing, plenty of hand gels around, and everyone really paying attention to the rules that have been set for people that are coming to work. Personally, I feel very comfortable coming to work, and I think we've really done an awful lot over the last couple of weeks to help with the whole COVID pandemic.
Hi, I'm Rob. I've been working on a lot of the hardware behind the scenes, keeping everything running, making sure everyone can connect to the system from home or wherever they need to, and it's always up.
Hi, I'm Matt. I'm in the analyst team, and one of the things we've been doing is working on EPS in non-GP settings, so things like out of hours and community, making sure patients can still get their prescriptions when places are short or working remotely, and also been involved in some of the research projects like the Open Corona and some of the flu cat things we've been doing.
I'm a student on placement at TPP. Here in the office we're keeping safe by social distancing. Being part of TPP's efforts is something I'm immensely proud of.
Hi, I'm Sam. I work at TPP. At the moment I'm working on quite a few recruitment things and making sure that everyone is staying safe and making sure that we still have applicants coming in for our key roles. Make sure you stay safe.
Hi, I'm Laura. I'm currently on placement here at TPP. I've been involved in getting supplies into the office to ensure that it's a safe working environment for everyone here, and we've been practicing social distancing as well.
Hi, I'm Danny. I'm currently on placement here at TPP. I'm really proud to be coming in and supporting all the teams during COVID-19. We're coming to work and it's a safe environment.
Hi guys, I'm still staying safe amidst the COVID-19 outbreak. Still coming into work but obeying all the social distancing rules and following all the hand washing measures and things like that. Our team have been doing a lot of work to help users of the system throughout the COVID-19 outbreak. We've been setting up a lot of shared admin groups to help users sort of work collaboratively. We've added a lot of new recodes to the system related to COVID-19, and we've been first, second and third line support for a lot of different organisations and users of the entire system. So it's been really busy, but we're all staying safe.
Hi everyone, just a quick update, just to let you know that we're all working from the office, doing a lot of work at the moment to support a lot of key NHS staff, making sure it's possible for them to work from home where possible. Just to let you know we're staying safe and socially distancing as well.
Okay, so we are practicing safe social distancing and making sure we're on top of keeping safe and clean. Just want to let my family know we're all okay, everyone's doing well. On the help desk, we've been trying to help users as well with social distancing. So we've had a lot of increased calls about enabling BDI, which we've been prioritising. We've been creating a lot of COVID-19 reports and status alerts and keeping users up to date with guidance from NHS Digital. We've also, as being first line support, we are hearing a lot of queries and suggestions from end users as to how we could make things better. So we've been discussing with our analysts the extra things to put into the system just to make everything better for people. So yeah, it's all going well.